Hello, everyone. I'm Jalen Brown, and this week's material will be based on the ACSM guidelines for exercise training programs. So, to start out, for the ACSM screening, we're going to go over the algorithm. So, the ACSM pre-participation screening algorithm is designed to identify participants who are at risk for cardiovascular complications during or immediately after aerobic exercise. And as you can see, cardiovascular is going to be abbreviated as CV during this PowerPoint. Um, Resistant training is growing, so current evidence regarding the CV complications during resistance exercise training cannot be 100% correct. This will hinder the pre-screening recommendations for exercise training. CV complications cannot like they can occur during resistance training, which is why the risk cannot currently be determined, but it seems to be low based on the results. So the components of the algorithm, there's five main ones. The first one is classifying patients by if they currently participate in regular exercise or not. The second one is identifying individuals with cardiovascular, metabolic, or renal diseases. The third one is identifying the patients with signs or symptoms of cardiac, peripheral, vascular, or cerebrovascular disease. The fourth component is classifying the individuals with type 1 and type 2 diabetes. The fifth component is identifying the desired exercise intensity for each patient. So within the algorithm components, you can identify these individuals in certain categories. The way that you can identify these individuals is by using what is known as the PARQ Plus. So the PARQ Plus is basically a physical activity readiness questionnaire for everyone that is deciding to participate in an exercise program. What the PARQ Plus is, it's about a 4 to 5 page document, and what it does is it it asks the individual questions based on their activity level or their exercise level for per day or per week. Participation in regular exercise. So people with cardiovascular disease can benefit significantly from being physically active. The current recommendations from the ACSM are 30 minutes or more of moderate intensity physical activity over the course of most days of the week. Moderate physical activity includes walking, climbing stairs, garden activities, and active recreational pursuits. For example, you got fast walking, running, cycling, swimming, or aerobic classes. The exercise intensities. So as we mentioned already, it's recommended 30 minutes or more of moderate intensity physical activity a day. ACSM recommendation guidelines for frequency, intensity, and duration of activity. So the ACSM just recommends, guidelines for each one of those categories. Either approach is beneficial for an inactive person. So you can go light, moderate, or vigorous intensity. Individual interests and opportunities should determine which is used. This means that however your patient is feeling that day or that week is how you should go along with it in the exercise program. So if they're feeling, they're feeling light intensity, then you should adjust to be on the safe side with them to make sure that they're getting what they need in your exercise program. Additional health and functional benefits of physical activity can be achieved by adding more time in moderate intensity activity or substituting more vigorous activity. So that means just adding more time to the moderate intensity activity, meaning going for more than 30 minutes or, going for more than an hour or for more than whatever your allotted time is with that specific individual. CV diseases and metabolic diseases. So CV and metabolic diseases are the world's top killers according to the ACSM. Both diseases are the most critical health concerns. Approximately 1/3 of all deaths globally are attributed to cardiovascular disease. 9% of adults have diabetes in the United States. Although heart failure is a major public issue, few treatments have actually been approved for this condition. Cardiovascular and metabolic diseases also, along with heart failure, are all a condition associated with obesity. Some signs and some symptoms. Some of these are common signs and symptoms for more things than just heart disease, but some of these are very serious. All of these I would include as very serious because, heart disease is not a joke. So, some signs and symptoms that we've listed is pain, and that includes discomfort in the chest, neck, jaw, arms, and other areas that may result from ischemia. Shortness of breath at rest or with mild exertion. So if you're, just sitting and laying and relaxing and you feel yourself out of breath, or if you get up and walk from the couch to the kitchen and you're out of breath, then, that can be a sign and that can be a symptom. The next is dizziness, and then we'll move to ankle edema, palpitations, tachycardia, mild claudication, unusual fatigue, and a shortness of breath with usual activities.